So intrinsic or mitochondrial pathway or apoptosome pathway. In this pathway, the first signal is the stress. The signal is sensed by the PS3 member puma, which will activate PEC and PEX protein and inhibit BCL2. These protein will polymerize and inside in the outer membrane they will form some pore. And with the help of these pore, cytochrome C come out, more protein SMAC come out, and endonuclease G. All these will come out in the cytoplasm. This will combine with APAF1 and the complex is called apoptosome. And this SMAC will inhibit, this IAP will inhibit this formation and that is inhibited by the SMAC. So indirectly SMAC is also helping in apoptosis. So this was intrinsic or mitochondrial pathway. Then next is extrinsic or death receptor pathway. Extrinsic or death receptor mediated pathway. The term is death receptor. So there are death receptor and their ligand. What are death receptors? FAS. It is also known as CD95. This is the receptor. And ligand is FAS ligand. FAS ligand. Number 2 death receptor is TNF receptor 1 and ligand is TNF ligand. TNF ligand. So these are the receptor and these are the ligand of the receptors. The receptors is like this. These are the receptors. This domain which is inside the cell is known as death domain. Death domain. And this is the outer part of the receptor. So this is known as death receptor. So how this pathway gets started? In case of extrinsic pathway, these are 3 death receptors. When they combine with ligand, this is the ligand. These molecules will undergo trimerization. They form trimer. After trimerization, they will form FADD. This is the FAS receptor and this is FAS ligand. And these are death domain. It is called FADD. FAS associated death domain. When this combine with procaspase 8. Why 8? Because E for 8. Extrinsic is 8. This complex is known as disc complex, death-inducing signaling complex, which activate this procaspase and it will become caspase 8. And caspase 8 will activate execution or effector caspases, which are nothing but 3, 6, 7, 12. And again, they will cause activation of endonuclease enzyme. And again, endonuclease will help in chromatin condensation. That is the characteristic feature of your apoptosis. So this is one part. So similarly, if this is trimer, death domain, and it is Fas receptor and it is Fas ligand. It is called FADD. It will combine with procaspase 8. Complex is called DISC. Similarly, we have a trimer with death domain. The ligand here is TNF and receptor is TNFR1 and it will form TRADD. This will combine with one protein RIPK1. RIPK1. So this RIPK1 is associated with this adapter molecule TNF receptor associated death domain. Because these death domains are TNF receptor associated. This may lead to two things. One, it may favor apoptosis by activation of the caspase 8, or it may help in cell survival by activation of some molecules known as NFKB, and it may help in cell survival. So two things are there. This RIPK1 associate with this adapter molecule TRADD that may lead to apoptosis pathway, that is activation of caspase 8, then execution or effector caspase 3, 6, 7, and then activation of your endonuclease, and your characteristic feature will come out chromatin condensation. Chromatin condensation. So this RIPK1, this is special molecule. It associates with TNF receptor associated these death domains, and it may drive this pathway toward apoptosis or toward the cell survival via activation of this molecule NFKB. So in extrinsic pathway, death receptors are there, and these death receptors may be your Fas and TNF receptor 1, and these are their ligand. They combine and form a trimer. This is adapter protein this side, adapter protein this side. This combine with procaspase and form a complex DISC disc that will activate procaspase into caspase 8. Similarly, this side RIPK1 protein either activate apoptosis or execution caspase are 3, 6, 7, and 12. They activate endonuclease and chromatin. So this is small pathway, extrinsic pathway. Till now, we have started with initiation. In case of initiation, there was intrinsic, extrinsic pathway. In intrinsic caspase 9, caspase 8 in human, it is 10. They will activate execution caspase 3, 6, 7, 12. 3 is important. Number 3 is very important. They will activate E for E, endonuclease. Endonuclease will, this is the DNA which is wrapping over histone and it is forming some structure, and this structure is called nucleosome. Endonuclease will cut here at this point. Internucleosome cutting. This cutting in between the nucleosome, it will give a fragment of 180 to 200 base pair. How to diagnose this fragment? Then we have one technique known as agarose gel electrophoresis. This is the normal cell with DNA. This is the normal cell. In case of agarose cell, we will find single band in case of normal cell. In case of apoptotic cell, because there are fragments of 180 to 200 base pair, so we'll find like this: small, then big, more bigger one, like this. So there will be, this appearance is called DNA ladder. So DNA ladder will be there in case of gel electrophoresis of apoptosis. This is how we diagnose on gel electrophoresis. So diagnosis of apoptosis, gel electrophoresis, that is your DNA ladder. Some bands will be there. Number 2 diagnosis was annexin V. Annexin V, this is apoptotic cell, phosphatidylserine. It will bind with the phosphatidylserine. Number 3 diagnosis is apoptotic bodies.